Okay.
Okay, thank you.
Is that better?
That's better.
Now I can hear
Great.
myself. All right.
Thank you.
Thank you.
We can hear you
Apologize.
now.
Okay. I swear the light was on before. Okay. So
Do you have testimony, written testimony?
I have notes, and I will provide them after the meeting.
Okay, thank you.
Certainly.
I would ask other people who are listening for future days to please send us your testimony by email in advance and the written copy for us to have with us during the presentation. Thank you.
Thank you. So Cuyahoga Job and Family Services is charged with administering the federal public assistance programs for the county for residents in need. That includes SNAP, Medicaid, TANF for cash, our prevention, retention, and contingency program, as well as our subsidized child care program. Our proposed budget, as you well know, is $80,222,231. The majority of this does represent staffing, roughly 65% of that. Our current population that we serve is on the rise with regards to our two major programs. Russia has risen as a result of the pandemic for our two largest programs. That would be SNAP and Medicaid. Currently, there are 430,000 people in Cuyahoga County who are recipients of Medicaid, and there are 220,000 people who are recipients in the SNAP program. Those are both right around a 10% increase since the pandemic started. Medicaid is a little more than 10%. For SNAP, it's a little less than 10%. We've had a decrease in our TANF population, slight decrease. We're now at just under 10,000. And we have had a significant decrease in our child care population due to two things. First off, the lack of not affordable, but the lack of a child care in general. Most child care facilities have shrunk their facilities due to COVID, and also simply the job market out there. A lot of people would prefer to stay at home, and there is slightly less demand for childcare. So those roles are down by at least 30% at this point. I want to talk a little bit about some of the challenges that we're facing as we go through as we've gone through the pandemic and what we're facing going into 2022. We have, I believe, as most of the county did, we sent 91% of our staff to work from home. We reached that number on April 6th of 2020. It has been a surprisingly positive experience, and by that I mean our productivity has actually increased during that time period. Based on that, we actually applied for a grant through the Food and Nutrition Services, USDA Food and Nutrition Services, and received a small grant to pursue this as a potential option into the future. We're in the midst of bolstering that program, trying to make it better, and the end of the funding period of that program is February of 2022, at which time we're going to do a full assessment for how well that really worked for us. So currently, our staff is still 91% at home and can receive their work at home. They all have state computers that have been logged in. They use a virtual private network to secure the connection. And they our public can reach us through the contact center. We have purchased a new voice over IP system, or contracted with a new voice over IP system that allows the calls to route to the workers' homes. So we're in a virtual office environment right now, and we have seen increased productivity. So that's going on right now. One of the things that concerns us as we move forward into 2022, a lot of things have happened with regards to the federal programs over the past year. Some of the requirements around the program have been walked back in response for the general public. And by that, the easiest example is interim reports for the SNAP program don't have to be filed. For most of the pandemic, they have not been filed. That will go away most likely when the federal health emergency is declared over. While they have not officially declared when that will happen, the messaging that we are getting from the federal government is that it will be at the end of December. There's been some scuttlebutt that it could go further, but right now the only date we've been told is December 31st. I do know that they have to give us 60 days notice. Okay? If they're going to start changing some of the waivers to the program, we're going to need 60 days. They have to give us 60 days notice. We're waiting on that. The other thing that has happened during the pandemic, and this is why Medicaid rolls are so high, is that there is no one is allowed to be kicked off of Medicaid. Can't close the Medicaid case right now, except for three very simple reasons, very limited reasons. Obviously, the death of the person who was receiving Medicaid, if they move out of the state of Ohio, or if they ask us to if they voluntarily ask us to close the case. So once the federal emergency is declared over, we have 12 months, according to CMS at the federal level, to review all those cases to determine if they still qualify for Medicaid under normal conditions rather than these pandemic conditions. And finally, regarding the SNAP program, I skipped over this for a second, individuals have been receiving the maximum allotment for SNAP over essentially since the pandemic started. I believe it started in April. What that means is when someone runs a SNAP budget, there's a maximum amount that someone can receive depending on the household size. It's just over $200 or $215 for a family, one individual who qualifies for SNAP. Normally, they do not receive that full amount because of other income that they have. It comes off their budget. They may only receive $15, $20 a month. However, during the pandemic, everyone has been receiving the max allotment. And then again, when the health emergency ends, that will go away. So we have concerns about what that's going to mean for the community and for the agency as that happens. So all of those things are kind of in the wings for us. It depends, a lot of this for our agency depends on when the federal health emergency is declared over. And we'll have to start to walk back some of those waivers and new policies, temporary policies, as that happens. Finally, and I wanted to, and Councilwoman Conwell, you asked me to address this. We have seen very high call volumes over the past 4 months for our agency. This has increased actually because of some of the waivers that are out there for us. So in April, May, and June of 2020, they essentially did away with what's called recertifications. People did not have to complete the recertifications, but they waived it for 6 months, which meant 6 months from then, you would see essentially the agency would have double the number of recertifications. This is for the SNAP program. And that happened in October of 2020. At that point, because statewide the volume was so high, the state rethought their process, asked for federal waivers. We were begging them to do so. They did ask for federal waivers, and then the numbers went back down to regular redetermination numbers. But because of the way they've been doing this, and I can't fault them because the initial intent was to serve the community who was facing a pandemic, but because of that, we now have this intermittent cyclical nature to that work. It tends to be some of our more hectic work, the redeterminations. People are very concerned about keeping food on the table and completing that recertification. And so rather than normally our normal load's about 7,000 a month, and in October it's 10 or 11,000, and it was 11,000, it was 10, 11, and 11 in May, June, and July. That has driven up our call volume. On the positive side, and you had asked Councilwoman Conwell about this, the call volume, the call wait times have gone up as a result of that. They've gone up so we've been in the very strange and chaotic environment for us of an ebb and flow to the work of sometimes it's great based on this new cyclical nature of our work. Sometimes we get this massive increase. So in April of this year, we had an average 5-minute wait time, and then in May we had an 8-minute wait time. Those are both better than our performance prior to the pandemic. And then June, July, and August, we saw it go up to 15 minutes. So it triples the time back compared to April, but April was a low month, and we were up at 50 to 60% of our regular workload in May, June, and July. And when that happened, that's still actually below, that average wait time is below where we were prior to the pandemic. Again, our people have been more productive during the work from home environment. And then in September, things spiked up to 20 minutes. As the call volume hit 81,000 for the month of September. Compare that to April, where we were at 42,000 calls. That's how volatile things have been in terms of our work volume and what happens. And some of it's depending on what's being messaged at the national level as well. When federal pandemic unemployment went away, or when they said it was going to go away the first time around, people panicked and called us. That happened in August of 20. When it went away here, we've seen it, that I think contributed to the volume increase for us in 2021 when federal pandemic unemployment assistance went away at the state level. But that is our contact center. That is a primary means by which we're talking to people, obviously. But as a program, the agency has done very well during the pandemic. For all our federal measures, we're doing very well. Our timeliness, which is simply this SNAP timeliness, is how long it takes us to, how many of our cases are processed within 30 days. Prior to the pandemic, it was anywhere between 76 and 89%. Since the pandemic began, we've been hovering between 94 and 99%. The federal goal is 95%, so we've been hitting that goal. And for the first time in a while. Make sure I hit those. Our error rate is down. Every agency across the nation is measured on their error rate for the SNAP program. Our error rate has been cut in half in 2021. As again, we've actually been able to, using our digital platforms, been able to provide the same level of support and training for our staff. So the error rate has actually gotten better. And finally, our long-term care case processing has been cut by 30 days. So we have reduced the amount of time it takes to determine Medicaid eligibility for people who are eligible for long-term care. So there's been a lot of good program performance improvements that we've seen in 2020 and 2021. Staff are appreciative of being at home. That doesn't mean we're not facing those retention issues that Director Weiskettel brought up. We are, but we're not seeing an incredible spike in turnover right now. We are experiencing roughly the same as we have in the past. So those are my highlights. So I'll open them.
Okay. Thank you very much for the presentation, and Ms. Conwell is first.
And through the chair to the director, caseload sizes pre-pandemic and now?
You wish to know the caseload size prior to the pandemic? Mm-hmm. So it was around 198,000 SNAP, around 380 to 390,000 in Medicaid. I can get firm numbers for you, but that's a pretty good estimate as to where we were.
Okay, and what are they now?
The others, TANF was at around 11,000, and childcare was around 27 to 30,000, just depending on the season.
Okay, and you spoke about the contact centers where most of the calls go through. Where are those staff located, employees? Are they at home? Are they part of the 91% that's at home?
The staff who are on the contact center, yeah, they're currently, outside of, I think, about 20 people, they're currently working from home. But I should pull the exact numbers. But 91% of the staff, both contact center and otherwise, are working from home.
And the Employment and Family Services, or Job and Family Services, they're currently open now? The building?
I'm sorry, I have tinnitus, so I'm
That's
asking you to
okay.
repeat yourself.
I'm
So I
probably
apologize for
speaking
that.
low. Is the building open now for people to come in?
Virgil Brown is open for business, yes.
And normal hours of what they were
9 to 4,
pre-pandemic?
because we are restricting, we don't have staff starting too much before 8 o'clock, so the lobby is open from 9 to 4.
Although I think the flexibility and the productivity for the employees being at home are probably working well for them, but then I'm also looking at the budget and, how it cost us for the overhead and all that. Have you started to have those conversations with David? If you're looking toward the future to kind of keep some of this flexibility for employees, are you having conversations about that use of that building and the lights and the gas and all that? Because it's one of our larger buildings.
Let's see if I'm answering the question. I've had conversations about the flexibility for staff in terms of, obviously, still affording the ability to work from home, and then I say that 91% are doing that. We also have a commitment to keeping the building open and providing people the access to in-person services. We are trying to limit the amount of time they spend there. That's really based on Board of Health recommendations in terms of if you're going to keep an open lobby, you want to get people in and out. We're trying to do that as much as possible and treat the lobby more as a triage than we are than having people sit for a couple hours down there. We don't want that. And we are but in terms of, and I'm not sure I'm fully answering your question, but we are looking at if we move into this into a more permanent option, what does that mean for the buildings? That is a conversation we're having, yes.
Okay. I'm just, and I think every business or agency is looking at those things now. I mean, we've seen, like you stated, we've seen some positive things come out of employees working from home, but what does that look like in terms of an agency as a whole? So if you have any conversations about that, or any direction that you guys are looking to move towards, please share me in those conversations.
So we are, pardon me, I may have to still one of the waters. We are looking at, our goal from the start, I should point out, wasn't that how do we get people home? A lot of people have asked me that question. Some people have approached it of how do we get people home? When we, and across the state, JFSs across the state, we're really looking at the same thing. Most JFSs have I think all JFSs at the height of the pandemic had at least 50% of their staff home. What does that look like? And so we made the decision early on to say, whatever we do, we don't want a gap in services. So we sat down as a leadership team with everybody that we put all our heads together and said, okay, what can't we do from home? Obviously, we can't mail from home. So we had identified that there were core staff in the building who could mail stuff out. How do we set up the process so workers can get them that, set up a common email box? Some of them, simple logistics things. But we addressed all those things before April 6th. We had a 3-week period where we were frantically meeting and discussing those things. We knew, because we had an experience for 2 weeks, we only had 50% staff in to protect staff, 50% people at home when we didn't have their computers placed in their homes yet. And that was a very bad time for us. Things went through the roof. The service level was not there, and that further convinces we need to make those moves. So our goal all along has been we want to have as seamless an approach to the services as possible. And so while, yes, I want to keep as a retention factor, a retention piece, the ability to be flexible and allow staff to work from home, I also want to ensure that the level of service is there. So we've put tracking mechanisms in place. We've looked at what's their productivity. We're looking at that on a regular basis. And we're setting minimum productivity levels as part of the grant for people to remain at home. So there's been an expectation that you're going to be you have to show us that you're productive to stay in your home environment.
Okay, and is there any truth to the matter that some of the employees don't want to come back? Is there any issues with that?
Don't want to come back to the office at all?
Yeah.
Yeah, I'm sure there is. So we've polled staff, I think 3 times since the pandemic began. First off, just to determine if they want to work from home. We feel that they did, but well, let's ask the question. And yes, they all wanted to work from home, or 94% initially said they wanted to work from home. Those who are at home, since we surveyed them since, want to stay in that environment. And there are some people that I hear through rumors that would not want to come back at all to the job if they were forced to come back into the office. It's not really where I'm approaching this from. I'm approaching this from, we can keep you safe, we can keep you, and you have been more productive. If you're more productive, I don't really care where you're at, as long as I'm still offering the services that we're required to offer and offering them timely, which we have been doing. So I would not be surprised if now, long-term, the goal would not be, I have some concerns with people I'm never seeing, so I don't want to hire people and not see them for 2 years. We are going to set up a rotation. Maybe I would, I don't know. No, I don't want to do that. So I would like to set up, part of the plan is to set up a rotation, so twice at least, and this is a proposal stage, there'll be a portion each quarter that you have to spend in the office. so that we get them in, we see them if they have supplies they need to bring back in. They can pick them up then, and that we're keeping some level of physical contact and keeping in touch with those people above and beyond all the virtual platforms that we're using.
And another question in regards to the 91% of employees at home and working on the state system. How are you managing confidentiality with those records?
It's a good question. Thank you for asking that. It's on a virtual private network. So to state computer, they can't get into the systems all the systems that they need without sending into a virtual private network. That's a further protection. There are requirements as to what their setup has to be, and we've requirements that they have to have their computer shut off when they're not at their desk. We can't check that, obviously, on a day-to-day basis. One of the more simple things that we did is you're not allowed to print from home. So one of the ways in which confidential information, unfortunately, just kind of gets out there is print. Now, we got some pushback from staff when that happened. I said, it's very much a confidentiality issue. I don't want people printing from home. I don't want you hooking up your state computer to your home printer. That can't be permitted. And that's why we had to set up a process where we email secure communications to mail out correspondence.
And how are you managing that? How are you making sure that they're not doing those type of things?
So that they're not sharing confidential. So first off, we do have an internal investigation team that's part of the fraud unit that investigates, and they will investigate any internal suggestions that something's wrong. Long-term, we plan on setting up so that as part of the we didn't do this as part of the emergency telework policy, but part of the long-term policy is that the county has the right to visit your home workspace at any point.
Okay. And you stated earlier, child care, through the chair, and I'm almost done, child care applications or applicants are down.
Mm-hmm.
I've been hearing complaints about applications. Do you think that is, maybe not on your end, but does that have anything to do with probably daycare providers are not open, or, you know?
I think I intended to mention at the beginning with that specific program that there's two factors. That's one, during the pandemic, they actually shut down for a little while. When they reopened, most of them had reduced capacity, so that's definitely a factor. But the other factor is that the workforce is changing. People are looking for jobs that don't require them to use childcare, and we're seeing that show up too. I couldn't tell you which one's more important at this point, but that's definitely, we're seeing 10,000 less cases than we did even at this time last year. It's just dropped, so.
Okay, thank you. Thank you, Mr. Chair.
Ms. Baker.
Thank you, and I was going to go there too with the security piece, but even beyond that, how do you handle, it's one thing when it was an emergency, everybody goes home, you have to kind of reorganize and figure out how you can continue the services from a place that people weren't used to working in. But now that it has evolved where we are giving options of working at home or coming in, and most seem to want to be home, how do you then turn that into a more permanent place of employment? You now have perhaps people who don't have a separate room in their home that they call an office. You don't perhaps have someone to help take care of the children during the summer or if they're not in school, and so they're there while that person perhaps could be working, and so they're managing both at the same time. How do you manage the interruptions from people coming over and not having that, strict environment where they know their schedule and what they're to do and when to do it? Perhaps there are those that are set up in their kitchen or they're set up in their family room. Maybe the TV is on. How do you have an environment from a home when it's no longer an emergency piece, but you still keep the integrity of what you had when it was in the office?
So thank you for the question. It's something that we take seriously. We're not going to change the printing thing, and I understand that's only one small piece of the puzzle. We will put into the final policy the concept that that the county can access your at-home office, and if we need to set up random checks, we may well do that. And I think we're going to seek some guidance from FNS on that, because this is an FNS grant. And then I'm not a micromanager. Or at least I like to think I'm not a micromanager. However, the new system, it's not even a new system. The application tracking system that we built as an agency starting really back in 2018 tracks what they're doing on a regular basis. So if I see gaps, I can see a gap from 12 to 1. I know you're on lunch. Okay? But if I see a gap from 1 to 2, I don't know what you're doing, and I know you weren't, and I also have another system. The contact center has very robust data. I can tell if you're not in the contact center. And so those two systems are tracking the two things that we care most about. Is the work getting done, and are we answering the phone? And so that tells us where the people are on a regular basis. We can stress it in the importance of keeping the confidentiality and the importance and the penalties involved with breaking confidentiality.
Are you planning on having some kind of parameters or policy of what you expect the workplace to look like when it's done from home?
So do you mean the physical workspace, though?
Physical workspace, interruptions, maybe multitasking of duties that are not involved with the day-to-day job, which is probably why a lot like to stay home, because they can do those things. I mean, what does it look like for you now that it's becoming permanent?
So it's actually, at some level, I would say a little more structured. One of the things that you kind of get rid of the water cooler when you get out of the office, get out of the physical office, you have people, you don't have people talking in between. You have them, you're at work from 8 to 4 or 8:30 to 4:30, whatever your shift happens to be. We
Right.
have to go on shifts too because we have to be available to the public. I can't really go to some sort of flex schedule where you work, 4 to 8 one evening or anything like that. We can't really do that. So it's based on us being available to the public. So it is fairly structured, and we do structure. You're on the contact center today, you're on the paperwork today. We're actually looking at taking some schedule changes around there, but really around those two things, of making sure those things are being addressed. Paperwork tells me, and I get independent reporting from the state office telling me whether or not we're affecting that and effective in that way. And the contact center, I get reports on a regular basis on how that's doing as well.
Yeah, I guess I would just ask that in this evolving time of people being at home, employees being at home and working, that environment is totally different than what they had when they were coming to the office. And I would think that there
It
would
is.
be challenges in that environment that need to be addressed. The issue of saving money because we're not using perhaps the utilities, or we're saving money, is there any conversation about an employee who's working full-time from home, that they're going to want to be compensated for the space that they're in, the utilities that they're using, the Wi-Fi, whatever it is that,
We have not during the pandemic. So I should say at the beginning of the pandemic, we had individuals were desperate to be safe and at home, so they're willing to use their personal phones, because we did not have this new phone system then. People used their personal phones. You could actually push the calls out to them using that. In June of this year, we finally got the phone system as part of the grant. Phone system also, for the first time, allows us to record calls, which is a huge upgrade for us in terms of customer service.
any other compensation that has been?
I was getting there, I apologize,
Yeah, it's okay.
Councilwoman. We've addressed that during the pandemic. We said we will not be covering that. We will provide you with a workspace in the office if you do not want to pay for your Wi-Fi. It is a bit of a trade-off. Working from home is a pretty big thing for working in the county right now. You do have to have secure, we provide the secure connection, but you do have to have high-speed internet in order to work from home.
Right. Okay, so it's a trade-off. As of now.
There is a trade-off,
It's a
yes. And the current policy addresses that specific, the draft policy, because it's not
Okay.
final yet. We've been working with HR and clearing that as we go, but that does address that. The county is not responsible for Wi-Fi charges.
If I may, the COVID calls that we paid for outside of what calls you do, have you been finding that people have been calling in? I don't remember the number, but it is a separate number for people who had COVID-19 questions.
Yes, yes.
You're not fielding those at all in your environment?
No, the one thing that we do get, unfortunately, is calls about unemployment, which actually make our phones light up when the state is responsible for, the state job and family services is responsible for unemployment. people come to us anyway because they see Job and Family Services. Unfortunately, I literally have no authority. I don't think I get a much quicker response than they do, because I'll reach out to the state for them. But that's the one confusion I've seen during the pandemic.
Do
Or
people call in to you and say, I have a question about where I can get my vaccination? What do? Just refer them to the number, or you just don't get them?
We don't really get that. We do post on social media, share some of the county messages, but we don't really get those phone calls, no.
Okay, good. Thank you, Chair. Appreciate it. Thank you.
Okay, well, I tried to be fair and didn't want to allow one and cut off the other, but I just want to remind everybody that these are the budget hearings, and that we've gotten off track on into a lot of operational type issues that are things that like the Health and Human Services Committee is really for, and going forward, we're going to come into days where we have a lot more departments that we have to try to get through in a day. So I would just ask my colleagues to please be mindful of that, so that we can get done the work that we have to get done. Any other questions? Councilman Schran.
From a financial standpoint, are we incorporating anything for workers' compensation claims that's going to fall? Because the work at home, all my readings on it say that you're opening up a whole series of slip and falls in the kitchen and bathroom and places that historically have not been thought about as workers' comp claims. And obviously with us being self-funded, this should be a budgetary item if it does. Have you noticed that at all?
It has not happened yet. To my knowledge, we haven't had a workers' comp claim from someone who's in a homework environment. It is something I've discussed with HR,
Sure.
But we have not had it happen yet, no.
We haven't built it into any budgets. We haven't built an increase in workers' comp claims on that. Okay. I would be surprised if it doesn't happen at some point after it becomes habit.
It was a concern we have. We have not seen it yet.
Okay, thank you very much.
Thank you, Council. Appreciate it.
And our final presenter for today is Director Tiffany Dobbins Brazelton. Tiffany Dobbins Brazelton, Office of Child Support Services. Welcome to the budget hearings.
Thank you, Chair. Good afternoon, everyone. So I am representing the Office of Child Support Services. The Child Support Program bolsters responsible parenting, family self-sufficiency, and overall child well-being by providing services to locate parents, establish paternity, establish and modify, and enforce child support obligations and collections for the children of Cuyahoga County. The Office of Child Support Services budget is approximately $42.2 million with 322 staff, which is inclusive of the Fatherhood Initiative Office as well. OCSS has collections averaging over $236 million as of the close of the 2021 federal fiscal year and serves over 127,000 children in this county. We are funded with federal Title IV-D matched dollars at 66%, federal incentives, which is program income, administrative fees, which is also program income, state match, and the HHS levy service dollars. The OCSS expenditure portion of the budget includes 2% cost of living increase, 5 cooperative agreements, which are from Domestic Relations Court, Juvenile Court Division, which are inclusive of magistrates and prosecutor services, 2 cash collections contracts with the Juvenile Court and the Treasurer's Office. We are not reducing or eliminating any existing programs, initiatives, or services. And the Fatherhood Office also has 11 contracts. So at this time, I will stop for any questions.
Questions by my colleagues, Ms. Conwell.
Thank you, Mr. Chair. My last thoughts. Director, any vacancies that you have that need to be filled currently?
Yes, I'm sorry, I don't have, the overall vacancy number is somewhere around 60, maybe a little bit more. But of those vacancies, I do know for our support officers or case managers, there are 39 vacancies, which we have 198 slots total with the support officer classification.
You gave me three different numbers, so 60?
That's for our overall,
Overall.
yes. But out of that, 39 vacancies belong to the support officer classification.
And does any of your employees receive any bonuses or anything?
No, they do
like that?
not.
And how did COVID-19 have an impact on support payments?
Actually, COVID-19, unfortunately, had a, I guess fortunately or unfortunately, had a actual positive impact for child support
That was a broad
because of
question.
the, I'm sorry?
That was a broad question, sorry. I know it had an impact.
But our collections soared. We actually had a record-breaking year in the area of collections as well as arrears collections. Our office was, in this county, we were recognized for most improved county. But a lot of that had to do with unemployment payments and things like that. People who supposedly didn't even have income. As we all know, a lot of people were eligible for unemployment some kind of way or somehow. So it caused a lot of work for us on the other end, for also unintended consequences such as double dipping payments or something like that. So there was a lot of manual labor that went into that. But as far as our outcomes, as far as numbers, that was the impact.
Was it taken automatically out of workman's comp and sent to you guys? Is that
Unemployment, yes, but that's the way we work. You have to either initiate that, if that's what you mean, but then it's an automatic payment process. But that's how a large percentage of child support works, through wage withholding,
okay?
even outside of the pandemic, yes.
Okay, so that's the large way, but then you also have where they can drop off and pay, right?
You can make voluntary payments, is that?
Oh, okay.
You can, but the preference and the preferred way, and if we have an attachable income source, that is what we will seek.
Okay. So
Okay, including your bank account.
So that's for the options where they want to voluntarily pay. That was my concern, how some of them might have gotten impacted if our places that they're allowed to pay were not open. So, I know we have one at Job and Family at Virgil E. Brown Building.
Oh, I see.
Yeah. So
So those locations where they could go in and make a payment on their own, that was closed for a period of time. Those are back open. Our top two collection sites are reopened, which is the treasurer's office, and then we also have our NIU department upstairs through JFS, but that is reopened as well, where we can take direct payments.
So no one had any negative impact if they, during that time, if they couldn't pay or?
I'm sure we suffered some kind of loss there, but what we tried to do is at least have the lobby area open, at least on our side, where we got another box, a drop-off box located in that area so you could drop off documents, which was separate from our cash collection, so that individuals would be able to bring that in and at least bring it into the lobby if they chose to do so.
You said matched Title 4D is the majority of our funds,
Correct, the 66% match.
so the rest comes from HHS levy?
And, sorry, administrative fees, which is a part of every child support order that we have. There's a 2%.
But what other funding do you get? Most of it?
You had it.
Okay,
Okay.
got it. Thank you, Mr. Chair.
Other questions? Ms. Baker?
It looks like on the average for your key performance measures, you're averaging about a 64 to 65% collection.
That's correct, but we actually ended up with a 66.5%.
Okay, it's not indicated 64.7 is 2021, and then you're looking to 64.8 in 2022, and then, if I'm reading this correctly,
I'm not certain what you are
or what I'm
referencing.
referring to,
I'm sorry.
it's in the budget book? Key performance measures, current support collected?
I'm not sure what year that was referencing. I know when I came before you in 2019, we were at around 64%, but the record that I was talking about took us to 66.5%
Okay.
for
Then-
federal, for 20. Oh, I'm down 2021. I apologize. So what I was referencing was federal fiscal year 2021, which ended as of September 30th. So you're looking at, as Director Papialis has shown me, the 2020 actual. So I was giving you what just occurred.
Okay.
Okay.
And so I don't see an increase here for 2023 or 2022 going into those years. Is there any recommendations that you would make to try and increase that from a 65 to a 70 or 75?
Well, our concerns were, and we thought long and hard on those numbers, but as I described, so the unemployment factors that were happening throughout the nation and in the state had a huge impact in the positive direction for our collections, but we have seen a dip in those numbers, which hasn't just been a trend for our county, but the state
Yeah.
and nation as well, as those factors have changed or are changing and continue to change. And with the suffering with unemployment, not unemployment, but employment period, people obtaining employment and that kind of thing, we're anticipating what our challenges may be with respect to that. So that's why you see the numbers the way they are for the next couple of years.
All right, I'm just looking at your performance measures from 2019 at 63.8. And then you hope to reach 64.8 in 2022. And I don't see the disparity in there because of the pandemic, but, or the unemployment or any of those variables don't show up in your numbers, or at least in the numbers that's presented to us in this budget book. I would think that these would be down if that was the case to maybe 55 or 50% collected. If,
You're saying that we would say our goal was 55%?
well, or you would show that that it hasn't been. I mean, these are past numbers, 2019 and 2020 is ending. It's just a comment that I'm making on in the budget book. Doesn't seem to match what you're saying.
And I understand what you're saying. I don't anticipate the numbers dropping that severely. That typically is not the trend for it to have that much of a dive, and part of it is also because of the way the incentives are measured, which is difficult for me to explain. But so I don't anticipate that much of a dip to go down that low.
Okay, I appreciate it. Thank you.
Thank you.
Anyone else? Councilman Sweeney.
Thank you, Mr. Chairman. Hello, Tiffany, how are you?
I'm great. How are you?
Good, thank you. Just, I learned something about with people that owe some child support and they become winners in the Ohio lottery. They're allowed to take the money, and sometimes it's significant. What impact is that having in regards to increasing the collection rate?
I don't have the exact detail, but it is successful for us in terms of one of the tools that we can use. That comes through the state of Ohio, that we're alerted as to there are some winnings and some earnings. And so it's just like other lump sums that we take within the child support program. So that could include, someone's bonuses. We also do what we call financial institution data match, which is a lump sum taken from someone's bank account. So there are rules around that. So you obviously have to owe the money as well before we would consider utilizing those tools. But it's a way to help reduce the amount of arrears that are on a case.
Thank you, Chairman, to the presenter. It's just trying to find every avenue so they have to comply with what the court has ordered to them, and they're not really willing to do that. And it's really cool that we work with all our partners to say,
Yes,
try
sir.
to box them out or in, whatever way you want to say. And
Yeah, that comes again through the state, so there has to be legislation for that in order for us to be able to do it. I will say not everyone doesn't want to pay their support. There could be other circumstances, that created a balance for someone. But again, just like with a credit card or any other expenses you may have, that is the tool that we can help reduce that debt.
Through the chair, thank you for putting it in perspective, because they might not be able to pay it. They win a little bit of money. They could pay it or not, but it's just a way to make.
Or the balance could have built up several years ago, for whatever reason. There could be a few reasons that the balance built up. There are a lot of people, don't misunderstand me, who do not comply with their child support obligation, but it's just not the case overall.
And through the chair, my last question is the limit's $600 or more, right?
For the lottery,
For the winnings.
I apologize, I don't have that detail committed to my memory.
Yeah,
If
I
it's
think it was
600,
higher, but it went down to 600, which is
Okay.
not that large a number, then you can take their portion out, as well as any else.
because
any
it's
other-
$500 for tax intercepts.
Okay,
So,
Mr. Chairman, thank you very much, and once again,
no problem.
Okay, thank you. Anything else,
Mr. Chairman?
Conwell?
Through the chair to Walter, there's something in the book I don't understand. The 2022, 2023 revenue enhancements under this child support office, it says a 7.7 decrease to employees' healthcare costs. Is due to the removal of the workers' compensation budget. I don't understand that. Can you explain that to me?
Actually misstated. We decreased both healthcare and workers' comp in 2022. We decreased healthcare for 2 premium holidays. We decreased workers' comp because we have a surplus in the fund, so we're not going to charge workers' comp.
Okay, thank you.
You're welcome.
Council President Jones.
Thank you, Mr. Chairman. Tiffany, I see the Fatherhood Initiative. I don't see a dollar amount for their budget. How is it reflected in?
That's a little over $1 million. So I think it was like $1.7 million.
It's combined.
But I gave you the combined figure, but you're asking me for the,
Right.
I got it right here.
Yeah, it's about $1 million.
Yep.
Yeah.
It is, yep, $1,017,459.
Has that been an increase, decrease, remain the same?
Flat.
Right. Okay. Was there a request for any increase from his department, if you call it that?
No, we didn't make a, no, we did not submit a decision item. But the last 2 years, because of the pandemic too, we have not been able to have the Fatherhood Conference, the annual conference, so that expenditure has not been there.
Went back into the
Yes,
Health Human Service Fund.
correct.
Okay, thank you.
Thank you.
Anything else?
Just wondering, through the chair to director, are you speaking on behalf of the fatherhood, or will Al come for that?
Well, for the budget hearings, I usually just include it
Oh,
in with the, to just fold it in with the child support. Other things, you may see the administrator for that.
okay, so any, since we're asking questions to you, any bonuses given in that department, and any vacancies in the, I know it's a small
I
department.
can answer
it's
those. So, no, we do not give any bonuses in that area. There is one vacancy. It's a small office, so there are only 3, including the administrator, but there's one vacancy.
Okay, and that department is, I know things are different right now, are they allowed to, what's my thought? Are they allowed to hire for that position?
We're actually looking to hire that position now. Okay? That is in motion.
Okay. Okay, I believe it is an office that's very large and very important, and the importance of it is not fully recognized. So we appreciate all the work that you and your staff do on behalf of the well-being of children and families in Cuyahoga County.
We appreciate that recognition very much. Thank you.
Thank you very much for coming in.
All right, thank you.
Does anybody have any miscellaneous business?
I do, if I
Yes.
may. I would suggest, Chair, that, as you said earlier, that it really would be helpful to have the notes ahead of time of the directors when they come, and I know you've asked a few times. So whatever we need to do to get that done, it helps to follow along and ask questions if we have it in front of us.
I appreciate your reinforcing that, and to Trevor, could you work with the people who are coming up in the next few days and help encourage them that we would like to have an email copy of their presentation a day or two before the meeting so that council members can look at it in advance. And also, we'd like to have printed copies available on the day of the meeting so that they can be distributed and people can follow along and see what information they have printed and what things they want to add notes to, and it'll just make it easier for us to do our work.
The second request, if I may.
Mr. Chairman, how many times have you made that request since we've been here?
I think twice, maybe three.
Five to hear? To hear bidding for five? Okay, whether it's three or four, I think that's pretty clear that your expectation is that you want to have them. And I've heard it from the colleagues up here, and I know we've heard it from you. At least, I think this panel has brought it up at least 3 to 5 times minimum. The only way you're going to have it is say, please come back and see us another time. That's the way you get things done. Sadly, you have to say, these are the rules. And if you expect them to be done ahead of time, please don't take the microphone unless you're prepared to take the microphone.
I thank you for that, and I
would support you
sincerely
if that's what you would.
hope- I sincerely hope that isn't going to be necessary. Thank you for bringing that option to our attention.
And Chair, if I may make
yes.
another note in miscellaneous. I've been struggling. I like to look at my recommended biennial budget as each person comes up and speaks, and it's very difficult to find the page. So I would ask the director, I know it's probably too late now, but if we had page numbers in this budget book, it would make it easier to reference where they're at as each one comes up.
Through the chair to Councilwoman Baker, our issue with the budget book is that it's created from so many different sources that it's next to impossible to number it afterwards.
Once you have the book and ready to print, you can't go back and put page numbers on?
We would still have to have it in one common application to number it properly, and we can't put it all in one common application. It's assembled in parts and then bound together. We tried to do the best we could with the table of contents and actually add an appendix to each area.
It's a struggle to try and find where it's at, even with the tools that you've given us. It takes maybe into their testimony to find that page. Perhaps maybe ahead of time, when we have the agenda, we could tag the page before we come. We could do that too. All right, thank you.
Walter,
Mr.
even
Chairman.
now, I think you could create a one-pager that just had a list of all the departments in order that would guide us through the book.
I can do that.
Or if I may add a suggestion in the future, perhaps alphabetical order as you receive them. Thank you.
Well, to my colleagues, yes, I share your frustration in this. I actually made the same request prior to the start of the hearings and was told the same thing. I would note that the items are listed in alphabetical order in a way, but it's challenging because things like office of and department of are not considered as part of the alphabetical. You have to go to what they considered to be the key word and look in that place alphabetically, but it is challenging and hopefully we can find a way to make this more accessible.
Mr. Chairman, again, I think the solution is alcohol, drug, and mental health services is the very first one. Make a table of contents with a one-sheeter that starts with the Adams Ward and goes on to County Airport. Give us that list.
List them out in order, exactly.
Okay, the only other item of business that I have is to make everybody aware that the next budget hearing will be on Thursday at 1 o'clock. I understand that we do have committee of the whole tomorrow. Is that correct for the Progressive Field lease? Is that correct? What time?
2 p.m.
2 p.m.
Yeah, correct.
Okay, so 2 p.m. is committee of the whole for the Progressive Field, and the budget hearing is Thursday at 1 o'clock. There being no further business at this time, we stand adjourned.